Infants of mothers with a high DHA fatty acid concentration in their breast milk have been shown to have improved brain and vision development. Likewise, dietary supplementation with EPA fatty acid during pregnancy and postpartum reduces symptoms associated with depression. So we've invited Dr. Paulo into studio to discuss the significance of omega-3 supplementation during and after pregnancy. So Paulo, let's start with a bit of a recap reminder where omega-3 fatty acids come from in our diets.
Well, omega-3 fatty acids are essential, meaning that our body does not produce them.
Right.
There are three main ones, the DHA, EPA and ALA. They are known by their acronyms. DHA and EPA are only obtainable from marine sources.
Right.
So fatty fish like salmon and tuna, for example, as well as krill. Whereas ALA is obtainable from plant sources. However, the body must convert ALA to one of the other two types. And that conversion process is not always efficient,
right.
Depending on the territory where it is taking place.
Okay.
So EPA and DHA must be obtained from food, from marine sources.
Right, right. So we know that omega-3s are really important for brain health and general health in the body. So I imagine when a mother is pregnant, it's all the more important that they're getting a good start.
Correct.
So what would the benefits specifically during pregnancy be of omega-3 for both the mother and the baby?
Well, we know for a fact that the pregnant women that develop depression even during pregnancy and postpartum are deficient in omega-3. Mm-hmm. So omega-3 is known to contribute towards preventing depression.
Right, right.
Omega-3 also contributes towards the period of gestation, in other words, the period of the pregnancy, so it has a benefit in terms of preventing preterm labor.
Okay.
In terms of the child, of the baby developing, it is extremely important for the development of the brain and the eye, the retina in the eye specifically. Those are some of the benefits that will accrue to the mother and the baby. Yes.
So, I mean, should a mother be sort of increasing her intake during pregnancy via her diet? Can she get enough via the diet that will generate the volumes that are needed for both healthy mom and healthy baby?
Look, that's a tough question to answer because obviously it depends on the mother's diet.
Right.
Now, it is unlikely that there would be many moms eating fatty fish on a daily basis.
Right, right.
Okay. And so because the demands increase during pregnancy, then the intake should likewise increase.
Okay.
Because it is now required for producing the baby as such.
Right.
Okay. So invariably during pregnancy, moms should supplement.
Is it safe to be supplementing?
Oh, definitely safe. There are many articles in obstetrics and gynecology medical journals that teach obstetricians how to educate their patients in terms of taking omega-3 fatty acids supplementation.
Okay.
Nowadays, in most of the world, in larger towns and cities, pregnant women tend to see gynaes and obstetricians rather than family physicians. But all of these health practitioners should be educated in advising the pregnant woman that she should and must supplement with omega-3 fatty acids.
And I mean, mothers are generally prescribed prenatal supplementation generally, but is omega-3 part of that, or is it now, why have they not sort of created a super supplement for pregnant ladies?
Look, because that depends on supplement companies.
Okay.
Supplement companies will do different mixes, different recipes, if you will.
Right.
Okay. If a pregnant woman is taken care of by government hospital services. Mm-hmm. I cannot speak for many of the other countries, obviously, but it'll sort of be the basics.
Okay.
So they will probably rely on folic acid, which is very important to prevent neural tube defects, B12 probably, iron, but I haven't heard that omega-3 is on the top three, so to speak.
Okay. The top three. I mean, but in your opinion, would you say that omega-3 should be almost a rule for
most definitely,
okay.
Because it is an essential fatty acid.
Right.
Remember that anybody's body, so that includes the mother's body, is continuously burning through omega-3.
Okay.
So the fact that there is a baby being developed in the uterus means that there is more omega-3 required for that development process to take place.
Yeah.
So, if assuming the mother was getting sufficient from the food before, she would now have to increase her food intake.
Yes, yes.
Which is not practical most of the time. So you have to supplement.
Okay. So now, Paulo, I mean, there's prenatal and postnatal. What are the benefits to both mother and child of her taking omega-3 supplements beyond actually giving birth?
All right, so those benefits will accrue to the child. Or rather, let's talk about the mom first. So in terms of the mom, post-birth, it will reduce inflammation. It will help mental focus.
Okay.
That has been shown. And of course, it will prevent depression.
Right, right.
In terms of the child, the benefits will be there if the mother breastfeeds, obviously.
Okay. Yes.
That's the only way of getting anything from the mom to the child after birth. So, but if the mom breastfeeds, it has been shown that those babies have better brain and vision development.
Okay.
They have better psychomotor development. And also, they have a reduced risk of developing food allergies and eczema.
Okay.
Which is obviously very important.
Yeah. So, I mean, I suppose it goes back to that thing of you want your child to have the best nutrition, but if you're breastfeeding, the mother is the source of nutrition, so you want her to be giving the best.
Yes.
And formulas and things like that, are they fortified with omegas?
They tend to be fortified the same way, for example, you can get omega-3 fortified eggs.
Right.
And one would think there is some highly technical process there, but it's very low tech. All they do is they feed the hens with flaxseed.
Okay, okay.
So those eggs end up having a little bit of DHA and ALA, because remember, the flaxseed in the hen's body, just like in your body, the ALA will be, some of it will be converted to DHA or EPA,
yes,
to one of the other two.
Okay.
But to what degree the egg is actually fortified, in other words, there's no way of measuring.
Yes, yes.
Okay, so one cannot rely on that as a source.
Okay. Now, Paulo, I mean, there is a question around sustainability, especially when we talk about marine sources. So traditionally, we talk about fatty fish like salmon and things like that for omega-3 supplements. But now krill oil has become quite a
Yes.
big one as well. I mean, how sustainable is krill oil, and is it potentially more sustainable or less sustainable than other sources?
Well, I think one of the concerns has been that because krill is the main food source for many marine animals, including whales, for example, the concern was there that you upset the ecology, all right, and therefore upset their menu, so to speak.
Yes, yes.
Now, most krill, for example, in Antarctica, it is estimated that at any time there are about 400 million tons of krill in that specific area. Okay. It is also estimated that the animals that consume krill will consume about 48 million tons of that 400 in a specific period of time. And remember, that replenishes again.
Yes, yes.
Humans only consume 0.2 million tons.
So it's a negligible amount.
So it's a negligible amount.
Yeah.
And therefore, the krill oil that is being produced in an ethical manner does not affect the environment at all. It doesn't affect the balancing act of nature, so to speak. It is from excess, so to speak, if I can put it that way.
Right, right. So, Paulo, we've actually found a phytopure krill oil from Phytoceutics, which we've added to our Real Health Medicine cabinet for this week. What would make this a good option to be considering specifically for supplementation for a pregnant mother now?
Krill oil contains omega-3, phospholipids, choline, and astaxanthin. And astaxanthin is a pigment, sort of a red pigment. It belongs to the carotenoids family, and it is a very powerful antioxidant. It plays a major role in cardiovascular health, for example. Choline plays a major role in brain health and in liver health as well. So those are sort of extra benefits that are not there with the omega-3 fatty acids from fatty fish.
Okay.
And then the other difference in krill oil is that the omega-3s are either in the triglyceride form, which is the form in fatty fish. A portion of it is in triglyceride, and the other portion is in phospholipid form, like the liposomal delivery system, similar to that, which makes krill oil have a greater bioavailability.
Okay.
All right.
Okay.
In this specific product, they're using a form of krill oil which is patented. It is called Superba krill. Okay. And it uses a special method called Flexitech. So it avoids high temperature dissolving methods. Okay. It uses a very low temperature fractioning method to separate the different substances and remove the so-called salt elements, so that there is no fishy odor or smell.
Okay.
So superba krill, which is the krill oil in this product, is the most researched krill oil in the world.
Now, Paulo, we've spoken before with omegas and supplements about that sort of thing where it repeats on you. It's fishy, or it doesn't smell so good. Or what is that? What's happening there, and how do they stop that from happening?
Oxidation is happening, and then the oil becomes rancid.
Okay.
So remember that there is a TOTOX score. A score of rancidity. So a rancid oil is an oil that has been subject to oxidation. So obviously the substances in there, the omega-3, have been oxidized, so they can no longer function as omega-3. Imagine they are now rusted.
Okay.
So in the specific product, for example, superba krill, because they use low temperature methods, they almost nullify the possibility of oxidation.
Okay.
So it's an excellent product.
And if somebody is sort of preparing to become pregnant or trying to become pregnant, should they be upping their omegas sort of pre-conception, or is that something that is appropriate?
Yes, most definitely. Well, from the point of view that most of us do not consume sufficient fatty fish, from that point of view, everybody should probably be taking an omega-3 supplement at some time, whether you take it every second month, which means that when you know that there are going to be increased demands, such as pregnancy, then of course you should begin before, if you are planning to become pregnant, because the development of the baby is most important in the first 3 months.
Right, absolutely.
And that's when there must be a large amount of everything that is needed, all the building blocks that are needed.
Paulo, where is this product available?
I believe it's available in health shops and pharmacies.
Wonderful. Thank you so much. Great insights as always.